I read this report that came out maybe 2 months ago by the American Hospital Association that was looking at hospital margins. And they said, before COVID, margins were 3.5%. In the second quarter, they were at negative 3%. And that's bad enough, but they would have been at negative 15% if it hadn't been for all the government funding. And they said, absent more government funding into hospitals, the margins for the second half of the year would be negative 7%. And that was a pretext for the American Hospital, or the logic that the American Hospital Association was using to say we should put another $100 billion into hospitals for stimulus to help them overcome this.
Yeah.
And let me finish the story. Yeah. So that came out. That came out a couple of months ago. The very next day, HCA in Nashville announced earnings, and they absolutely crushed it in the second quarter.
Yeah.
And a lot of that had to do with their share of the stimulus money. But I could actually hear the cursing in the AHA headquarters, right? Because what all of this stimulus and all the excess funding is doing is really creating bad habits inside many of these provider and payer networks, and we, the people, pay the price for it. There was some thing from Politico earlier this week that said a doctor that worked for a freestanding ER clinic in Texas went in to get a COVID antibody test, which he administers all the time, and the raw materials for that test are $8. Anyway, they took his insurance information, and he ended up paying over $10,000, or his insurance company ended up paying over $10,000 for a COVID antibody test.
Yeah.
And it just shows you the level of profiteering that occurs, and it's not technically legal. It's immoral, but it's not technically legal.